duplicate much activity so that we can speak to each other, so that we can interact, so that we can see how best we work, how best we protect, how best we help our team of populace. Apart from this issue of collaboration between various supporters and Ministry of Health, uh, I also want to see how best we can uh, maybe address some of the challenges that you have highlighted. In fact, I have the honor to tell you that I have received your letter, and currently our co-chair technical is looking at your proposal and even the challenges that you have highlighted. And very soon, I think maybe today or tomorrow, you'll be able to send his feedback to the ministry so that we can forward your request appropriately to His Excellency. His Excellency is really keen, is excited with this your proposal. More so because the chief of staff has tried to call this your numbers in the presence of His Excellency. His Excellency is really happy to really have this. And our hope is that even after COVID-19, we'll be able to maintain the structures that we have now on ground, so that we can improve, especially as is now the order of the day, not only in Kano in Nigeria but across the world. So virtually these are my few comments that I want to render. I submit.
Okay,
Thank you.
thank you very much, sir, for the comment. We're really grateful and we are glad to have you on board. Thank you very much, sir. Professor Adizagaladen Chima. Um, Hello, ma.
Yes.
Yes,
All
ma.
right.
Okay.
So thank you very much. And I think we need to thank the Chief of Staff and the Commissioner of Health, Honorable Commissioner of Health, for supporting this endeavor. If you remember very well, right from day one, even before you started, when you contacted me, I said that this was a very good endeavor, and it's something that is actually necessary at this particular time, just as the commissioner has said. But I said we have to be very careful and we have to trade very carefully. One of the major problems that this such endeavor can cause if we don't do it the right way is reducing the quality of care that we give our people. Now, out of the 50% of that's almost 400 people that you saw, how many of them did you actually manage correctly? Because for some of them, they actually need to be physically examined or need to have some tests done before we take a decision to give them drugs. Where you have call centers, usually they are linked to health facilities, such that you can screen at the call center. If I call now and I said I have a headache, you can decide just to give me paracetamol. But probably my headache is because I have hypertension, or probably because I have low sugar level. But if you're not able to screen at that level, to know who do I just give that paracetamol and who do I need to say get to the lab to do a blood sugar, or get to the health facility and do a blood pressure. Now, these are issues that we have to be sure that we're giving our patients the right quality of care. If not, we're going to be complicating more issues. People will think, yes, they're getting healthcare, but they're not getting the right healthcare, because we know it. We're supposed to take full history. We're supposed to examine a patient. We're supposed to do investigations before we treat. There are very few instances that you just hear somebody and then you just give him a drug. So that is where I just have a problem. And I've said that, and I told you that really we need to sit down and think of the best way that we can do this. There's no doubt telemedicine has to be one of the options of management. And that's all over the world. And everywhere there are call centers and telemedicine, but they do it the right way. You should have, linked to health facilities. You should be linked to laboratories. You should be linked to radiology services. You should be linked to emergencies. if you're linked to emergencies, you might even be linked to an ambulance, because a patient can give you a symptom, and what you think is that that person should immediately be seen by a doctor. So it should be linked to an ambulance, that ambulance, you can tell the ambulance, go pick this person in this house and take that person to this emergency. That's how they do all over the world. So I think we have to trade very carefully, but this is an excellent initiative, and this is the sort of innovation we want in our healthcare. But I think we need to sit down and really think of how we can do it the best way. And I'm very happy that the Honorable Commissioner has said there are other people that also have similar proposals. So at the end of the day, we should all sit down together and see how we can do it the best way. And I think the government coming in will really assist this group, but because I think you can't do it alone. You need definitely assistance. Thank you very much.
Hello?
We can't hear you now. Or maybe I wasn't heard as well.
Okay, can you hear me now?
You were well heard, ma. You
Okay.
need to unmute.
Okay, thank you very much for the comment, and you've been helpful throughout all the things we've been doing, not just Kora E-Clinic or Kora, you've always been there for us. And to make a few comments, we're working hand in hand with the FEMA and the Guild of Medical Directors, so that we bring clinics on board and private and public health institutions all over Kano. And what we have currently now is we have some labs that we are currently working together with, about 30 of them all over Kano State, where our doctors can send patients for any investigations. And we also have some hospitals, because we do receive calls from patients we couldn't attend to. Some were emergency and there was nothing we could do. We had to tell the patients to go to the nearest hospital. And currently we're working on a standard operational procedure, which will guide our doctors on what to do, what can be treatable and what cannot be treatable. Thank you very much, Ma, for the comment. Together with me here is Professor Isa Abubakar. I'd like to give him the device so he can introduce himself.
Hello, everyone. As he said, Isa Sadiq Abubakar. I'm the Director, Center for Infectious Diseases Research, Bayero University, a consultant public health physician with Aminu Kano Teaching Hospital. I'm the Chairman, Faculty of Community Health in the West African Graduate Medical College, that was African College of Physicians, and then the National Vice Chairman of the Association of Public Health Physicians of Nigeria. So you are all welcome to this meeting. This Center for Infectious Diseases Research takes up this initiative as its own, because we are being encouraged by this young colleague of ours who have come together to establish something that we, the elders, should have established, but then they have drawn us into it, and we are definitely partners in progress. We have a lot of connection within the medical cycle, and I can assure you that we are going to use our might to pull everybody who has some contributions to make in this. So we are all partners in progress, and I just hope and pray that we will all have the same zeal that we are starting this with, so that we can take this to the next level. Thank you very much indeed.
Thank you very much, sir, for the wonderful comment. Professor Tunde Bomboshe, sir. We,
All right. Yeah. Can you hear me?
yes, sir, we can hear you.
All right. What do you want me to do? Make an address?
Yes, sir, maybe a comment or two.
All
The
right.
meeting
So,
was come to an end.
well, like I said earlier on, it's indeed a pleasure to work with Cora. It's very laudable, the objectives you have set up for yourself. And you're very lucky the Kano State government is fully in support of your mission, as highlighted by the Commissioner of Health and the Chief of Staff to the Governor. So you are in a very good position to succeed. And of course, you have all these big professors, and Professor Issa himself giving the backing of the entire Center for Infectious Disease Research to support CORA. So it's very good. And I can also tell you at this point, you have the full support of the Hospital Dental Center at the Aminu Kano Teaching Hospital to support all the mission and vision of your organization. So we will back you fully with all the facilities that we have. However, like Professor Badanchi did mention, there are limitations to what telemedicine can do or telehealth can do. As physicians, we're all trained to examine patients, to have interventions and interactions with patients. So when we adopt telehealth, it's a modification of what we've been trained to do, but it has very severe limitations. So we will need to adapt it to exactly what we want it to serve. First will be to have an initial consultation with the patient who may be at a remote location and cannot easily access health at that point. So during such initial consultation, we may be able to evaluate the patient and give opinion and direct the patient, like Professor Galanchi said, direct the patient to the nearest facilities where such patients can be seen. And in case of dentistry, you know that most of the things that we do in dentistry require surgical intervention. So it's not every patient that has a swelling that you can easily say, hey, go take paracetamol, hey, go take antibiotics. It may not really work easily that way, but we can see them and give some relief that, okay, they're seeing doctors, then we direct them to the nearest facility or tell them to come into our practice where we can see them. And looking in a broad sense, telehealth would actually benefit one component of medical practice, which is the business side of practice. You know, in every medical office, doctor's office, there is a business side and there is a clinical side. The business side, as at this moment, is being run virtually on a virtual platform. So telehealth can take care of that. Making appointments to see doctors can be done on telehealth platform. Making appointments for follow-up care, having treated a patient in your practice, patient goes home, 24-hour follow-up, 48-hour follow-up, 1 week follow-up, all of that can be done on the telehealth platform. But for the most part, we are trained to see our patients, we are trained to examine patients and make diagnoses and institute intervention. So telehealth, for people who are in the rural area or indigent patients, it may benefit them, but on the long run, we're actually directing traffic to clinics that are in their domain. And lastly, for my comment, I was going to mention something about cost of service to patients. It will be a form of a question. So when, for instance, a patient at, say, Ngogo, I know about Ngogo local government, for instance, a patient out there calls the e-clinic needing to talk to a doctor at the dental center, and the doctor speaks to the patient and advises the patient on what to do. Perhaps a prescription could help the patient. Who pays for the services? I am assuming members of the community will suppose that services rendered by Cora e-clinic are free. If that is true, and that is good, but there is really nothing free, because patients will go to the pharmacy to get their prescriptions filled. That will not be free. Some patients will go to some laboratories for investigations. That will not be free. So I'm asking, Cora may need to make it very clear what parts of the services are free and what parts of the services will the patient need to pay for. Once again, I'm really happy to be with you guys. It's indeed a honor. Thank you for the invitation.
Thank you very much, sir. It's such an honor to have you on board. You've also been supportive of whatever we're doing. It's good, sir. We're really grateful. We're really honored to have you.
Thank you.
Like I've said earlier, the Cora E-Clinic, we're currently working on to see how we can partner with various hospitals, various dental hospitals all over the state. We've already done that for pharmacies and laboratories, medical laboratories. We have a list of them, and they are strategically located all over the state so that the patient don't have to go too far to access care. And for we're currently working to bring on board the private and public hospitals. And for the services, the consultation is what is free for now. And we're still looking at the issue of sustainability, because the number of calls we've received showed us that people really need this service. And so we're looking into ways we can actually sustain the service even after COVID-19. Thank you very much, sir, for the comment. And Professor Swade, sir.
Thank you very much. Like I said initially, this is actually indeed a laudable project that you young men have actually started, and it will go a long way in actually easing the difficulties that patients normally go through in accessing health service. Now, like my teacher, Professor Hadiza Galanchi said, and even by virtue of my training, I am the intervention, if I can say that. Reason is because when doctors see patients, they end up referring patients to us actually to either scan or do a chest x-ray or any other x-ray, or actually do a CT scan or even MRI. And this is something that cannot be done via telemedicine naturally. It cannot be done. So the way I see it, yes, your initiative can actually help and smoothen things for patients to actually have a consultation, but by and large, eventually the patients would definitely need to actually come to us and see us for so in such a way that we can actually offer our own help. So it's like everybody has said, it's a good initiative. It's going to smoothen things for some patients and make things easy for them. But for my own side, patients would definitely have to come to me. They do have to come, because we cannot do X-ray via telemedicine naturally, But by and large, it's a good thing. Thank you very much.
Okay, thank you very much. Thank you very much. Unfortunately, we promised that the VT is not going to last longer than 1 hour. We have to stick by our. It's already 4:54 now. So I know we almost everybody have something to say, but I don't know, sir, if you permit me to bring an end to the lunch, because so that we don't exceed into the time, so that we don't take too much of your time because of commitments we all have. I think we may have to end this now. So we are here together with the rest of the team. They're all seated here. So maybe I would like to, before we go introduce them, at least maybe say their name, and then we end the meeting. I don't know how we're going to do that. Should I be passing the phone? Okay. You do it very fast, please.
Okay. My name is Bashir Swade, and I'm the head contact and mobilization resource for Cora E-Clinic.
Hello, my name is Makia Suleiman. I am the community lead advisory team.
Hello everyone, I'm Ishaq Mohammed Kabir. I'm the head of admin team.
Hello everyone. My name is Abdul Jabbar Aliu, and I'm the head of the ICT Cora eClinic. Thank you all.
Hello everyone. My name is Abdullah Suleiman Wali. I'm a volunteer.
Hello everyone, my name is Nigel Lamifu, New Media Group.
Hello everyone, my name is Imad Mustafa and I am the head doctor schedule for Cora eClinic.
Hello everyone, my name is Mujahid Babangida. I'm head of planning Cora.
Thank you very much all. This is part of the team, though they're not all here. We're trying to keep social distancing, so we kind of respected the number. Thank you very much, and I would like to particularly thank Professor Swade because we've been co-sharing his office. It's been really helpful. His office has been the office of Cora eClinic since we started. Thank you very much, sir, and Professor Isa Abakar also for hosting us, and all of you for all the support. We couldn't have done this without you. Thank you very much. We are really grateful, and I hope we can all work together to give back to the society, to help our people at large. Thank you very much.
Thank you. Thank you very much.
Thank you.
Thank you.
Yeah. All right. So have a nice day.
Thank you.
Bye. Lai bada sa.
Amin, ma. Thank you very much.
Okay.
Thank you very much.
MashaAllah.
Okay.